these blue prone, right? Prone pillows. Up there, which I've received mixed feedback whether they either love it or hate it, right? And so really just ask your patient for comfort, what do they prefer? Because they're potentially here for about 10 to 15 minutes, right? So this is a prone pillow where they can put their hands underneath here, right? And I can, with the towel, so I'm just going to just show you how this looks like, okay? So with a towel, you want to make sure to place here for their face, right? So their face isn't on the plastic, right? And then let's try this out, Sebastian. Let's see if you like it or hate it. Let's see. All right, so you can put your head just straight through, and you can put your hands underneath if you like. All right, so that is the prone pillow, and that's how you use it, right? This is especially great, right, if you're treating this cervical and upper thoracic area, because the position of the head is so important as to how these muscles are, the tension of these muscles. So we want to make sure that they're in neutral so we can have better, better access to these muscles, right? And the patient is relaxed. Right. So if I'm only treating the right side, I'm gonna go ahead and cover his left side. Very clear what is the area that I'm going to be treating, right? I did lower back and thoracic just so when I'm doing the strokes you can really see the strokes. But if you are just treating the low back, then your draping might look something like this, right? If your plan of care only says low back, then your draping can look something like this, right? Because you just want access to what your plan of care states, okay? But for demo, I'm just going to give it a little bit larger so you can see the strokes as I move through them. All right, so, okay. So after number 3, I've positioned my patient appropriately. Okay, so prone position, gave him offered for comfort, either the prone pillow or a towel, whatever, to make them feel comfortable. I've draped up correctly, exposing the area to be treated only, right? And providing modesty for the patient. So the area that I'm not treating, making sure that my patient is all covered up, checking their legs, checking the other side, making sure that my patient is covered and ready to go. Okay, I'm gonna communicate with my patient the procedure. So Sebastian, what we're going to do is I'm going to be doing a massage in your lower back, in your back area here. This should feel relaxing, okay? At any time, if you feel any pain, please let me know because we don't want this to be a painful experience, okay? I asked for patient permission, right? At the beginning, right? If you allow me to treat, they said yes. And I've given them clear instructions as to my procedure. I'm going to visually inspect the area that I'm going to be treating. I don't want to see any rashes in the area that I'm going to be treating. I don't want to see any wounds, open wounds in the area that I'm going to be treating. So after I've done that visual inspection, they would be, right, a candidate, right, or working towards being a candidate for the massage. Then I'm going to ask them about their allergies, right? So Sebastian, are you allergic to coconut by any chance? No? Alright, so I'm going to be using the Deep Prep because Deep Prep has coconut. Alright. After that, I am going to let Sebastian know that I'm going to be checking for sensation, right? So Sebastian, I'm going to be placing my finger along your back and you're going to let me know if you feel it or if you don't feel it, okay? Alright, so do you feel it now? No? How about now?
Good.
How about now?
No.
How about now?
Good.
Okay, awesome. So sensation is intact, I can proceed. Alright, before I do anything further, another thing that I want to do is check contraindications and precautions, right? Even before starting the treatment. Any contraindications for massage that we know of?
Disease, skin rash.
Alright. Do you have a fever?
No.
No, right? It's a contraindication. Any precaution?
Fragile skin.
Alright, so fragile skin, who would have fragile skin?
Older patients.
Right, either the elderly or too young, right? So that's something that you can see. What can I ask? Oh, sorry.
Anticoagulation medication.
Okay, so are you on any anticoagulant medication?
No.
Alright, awesome. Perfect. So I'm gonna go ahead and clean your skin. It might be a little cold. Attention.
This is my favorite call.
Takes just a minute.
Sorry.
Been there, done that. Okay, so I clean the area that I'm going to treat, and then I can throw this out in the trash. I'm not gonna leave my patient. If I do leave you, Sebastian, I'm just gonna put a call bell on this side over towards your left hand, okay? Just make sure it doesn't fall. I'm gonna put it in here so it doesn't fall. Okay, awesome. I can move this, right, to where I need it to be. Right? Am I missing anything before starting? No, okay, alright. Awesome. So I'm gonna go ahead and start with your massage. So for the Deep Prep, right? So you can go here and spread it on your hands. Once you start the massage, you can take off the hands from the patient, take off your hands from the patient. So I'm gonna start with a light effleurage, and I'm gonna choose to do the stroke shingles, right? So here, going straight underneath, shingles, always working up towards the heart, and then maintaining contact as I come down, up towards the heart, light effleurage, assessing, right? Spreading out the lubricant, and then again, shingles here, light effleurage. Okay, if I feel like I need more, I can place the back of my hand on my patient. Sebastian knows through my nonverbal communication that I am here, right? And then I can get more lubricant or emollient, Deep Prep here, and then I can continue with my strokes, right? And to spread the Deep Prep all throughout my patient's back. Okay, so here's shingles. Very clear to everybody in the room what stroke I'm doing, right? Shingles, maintaining contact, shingles here. Light pressure here. All right, so that's shingles. I'm gonna do a second stroke for light effleurage, and this time I'm gonna choose to do knuckling. So knuckling, starting with your most proximal here, going towards the more distal, and then around. Notice how I haven't let go of my patient, or I haven't taken my hands off the patient as I am resetting. Okay, so you're here. And here. Is this uncomfortable, Sebastian?
No.
Does it tickle you? No? Okay. So you're here. Here.
So for comps, we have to do all three, or is it just we choose one or the three?
You're gonna choose two,
Oh.
right? So now I'm still working in light effleurage. Notice how I'm not going deep into my patient. I'm just getting him used to this, my touch, right? Used to the emollient, right? And used to the massage. Okay. All right. So that is knuckling here, light effleurage. I'm going to show you now bilateral tree. Okay. I can move into, already I've done 2 strokes for light effleurage. I can move into what part of my massage? Deep effleurage. So I can choose to do bilateral tree in deep effleurage.